In this video, I'm going to be sharing what my favorite labor comfort technique was and a few different variations that you and your partner can do so that you can be more comfortable during your birth. Hey, welcome to the MamasteFit YouTube channel. My name is Gina. I'm a prenatal fitness trainer and birth doula and currently pregnant with baby number 4. And so I am starting to prep for my own birth and figuring out what labor comfort measures that I want to use. During my last 3 births, though, my favorite labor comfort technique was counterpressure, where I had my husband pressing on my hips and applying pressure to release tension and to make my contractions significantly less painful. And so in this video, I'm going to share 4 different variations of the double hip squeeze that you can do to find relief during your birth. But if you want to learn more labor comfort techniques and ways to be more comfortable during your birth, because it's not the most painful experience ever, I wouldn't describe it as pain-free, but there are definitely techniques that we can do to make it way more manageable. Check out our online childbirth education course, where we break down tons of labor comfort techniques such as counterpressure, because there's a bunch of different counterpressure techniques that you can do, different tools that you can grab like a TENS unit or massage balls, and then also different comfort techniques that don't involve touch as well. So first, let's break down what is the double hip squeeze. With the double hip squeeze, we're applying pressure to the pelvic bones, and this manual pressure is releasing tension in the uterine ligaments. So your uterus has a bunch of little ligaments that attach it to the pelvic structure. And during contractions, all of these ligaments are going to be pulled on, and they're going to become a lot more taut, which can be pretty uncomfortable. And so when we apply manual pressure to the pelvis, it helps to decrease tension in these uterine ligaments. In addition to that, firm pressure can help to release endorphins to make our contractions way more bearable. And so because we're applying manual pressure to the pelvis, there is some concern that if you're pressing onto the pelvis, we're making the pelvis smaller, which could impact labor progress. However, I don't believe that applying pressure to the pelvis is going to negatively impact your birth, because if counterpressure is helping you to relax more, we have to remember that there's a lot more than just bone that our baby is navigating through. There's also tons of tissues and muscles and ligaments that baby's also moving through. And so if we're releasing tension in this area, it's going to make it much easier for our baby to pass through. In addition, if we're tensing up and fighting our contractions, it could make it much harder for our baby to move through our pelvis and for our cervix to dilate. And so by applying counterpressure is helping to relieve some of that pain, which can also help you to relax to enhance your labor progress. So although applying counterpressure may slightly decrease the pelvic diameter, since we are applying manual pressure to the pelvis, the benefit of relaxation from that counterpressure technique is so much more beneficial than the potential negative impacts of that slightly decreased space. So for me, the relaxation benefit of counterpressure significantly outweighs any sort of decrease in pelvic diameters that may occur. In addition, as you move through your labor, you will find that different types of counterpressure techniques may be your preference, and different ones tend to create a different type of space within the pelvis as well. And so in this video, we're going to be breaking down the double hip squeeze, which is a really common labor comfort technique. With the double hip squeeze, I'm going to be applying pressure back here to the pelvis, so right above where your hip is, but below where this hip crest is. And in this little space, I'm going to be applying kind of upward pressure. With that, as I apply the pressure, it tends to create more space in the top of our pelvis to help your baby begin to rotate or navigate through. The double hip squeeze is usually easiest to do if you're in a tabletop position or you're leaning forward where the hips are presented. It's usually a little bit more challenging than you do in like a seated position, but not impossible. So with it, as the partner, you're first going to find a comfortable position because you're going to be applying this pressure for potentially several hours over labor. And so making sure that you're in a position that's comfortable for you is going to be really important. So we're going to start by finding the bony bump of the femur head, and it tends to be out a little bit further than the rest of the booty. And so you'll feel for this bony bump, and then right above that, the fingers will sink in a lot more. And that's kind of the target area that we're aiming for. But again, we're all individuals, and so communication is going to be key with counterpressure. From there, I'm going to take the heel of my palm and place it into that little gap. And then my fingertips are going to be pointed up towards the spine at a diagonal. And then I'm going to press kind of up and in to help apply this pressure. So I'm going to have my elbows out. I'm going to press up and in to apply this counterpressure technique. I would hold for the entire contraction. And then when the contraction was done, I would slowly release. And then I like to do this little kind of like rub thing where I'm kind of like, let the contraction go. You don't have to do that if you don't want to. So that's one of the ways that you can do the double hip squeeze, is just by applying it with your hands. But because you're holding it for a full minute, it can get pretty fatiguing. And so another way that you can do it is with your knees instead, which you could only really do if they're in a tabletop position. So from here, you're going to stand over that same general area, and I'm placing kind of the inside of my knees/shins, depending on how tall you are in comparison to your partner. And then I'm just going to squeeze my thighs together to apply this counterpressure technique. So if you prefer leg day, this may be a great technique for you if you don't like upper body day quite as much. And so you would hold this pressure for the duration of the contraction, and then when it was done, you would release and let go. The downside of the knee squeeze is your partner has to be in a tabletop position unless you were just like extraordinarily tall, but it does kind of limit you on laboring positions, and the sensation is a little bit different. Another way that we can apply the double hip squeeze is with some fabric. And so I'm using a rebozo here, but you can use a scarf or a bed sheet as well. We're just looking for some long fabric, but I'll link the company that we got these rebozos from. And so first, as you wrap the rebozo or scarf around the hips, we want to make sure that it's below the belly. So we're not going to be compressing on to the belly. And then we have a few options here. So first, they can be in any position. They can be sideline. They can be standing like this. They can be in a seated position. This is where we can get really versatile with positioning because it's really easy to kind of get this into the little nooks and crannies. Then I'm going to crisscross the fabric across their back and then push and pull. So I'm pushing with this hand and pulling with this one to compress around the hips, essentially kind of like tourniqueting it to help apply that pressure. This does feel a little bit different than the other hip squeeze variations, but it can be a helpful technique, especially if you're getting really fatigued applying all this pressure. You can also do this with two people, so one person can hold one fabric, and then you can hold the other, and then you can pull on each end to help apply the pressure as well. The last technique that we can do is going to be a self-applied counterpressure technique. So this can be really beneficial if you're driving or for whatever reason you're laboring by yourself and your partner is occupied with like driving the vehicle or getting you some water. And so we can also use a wooden spoon to kind of help tighten around the hips. So you'll take the fabric to tie a knot around that little femur head area. And then you'll insert the wooden spoon through the knot. And then again, we want to ensure that the fabric is below the belly. From there, you're going to essentially twist that wooden spoon to tighten it around your hips. And then you'll just hold it there throughout the duration of your contraction and then slowly release when the contraction is done. So this is like a great option if you're laboring by yourself or if you're driving to the hospital and you really like the counterpressure technique to apply it by yourself. The double hip squeeze is one of my favorite labor comfort techniques that I've used during my last 3 labors, and I'm anticipating I'm going to want to use again during this one to help find relaxation and relief during my contractions. As you do the double hip squeeze, one, it's really important that your partner is in a comfortable position because they're going to be applying this pressure for a prolonged period of time, so it's important that they're able to sustain that. Other things that can be helpful for your partner is to also emphasize strengthening the chest musculature and triceps as you kind of move through that last part of your pregnancy, because labor support is also physically intensive as well for them. And so physical preparation can be really beneficial. You can apply the double hip squeeze with your hands, with your knees if they're in a tabletop position, and then we can use external props like a rebozo or a bed sheet to help tighten around the hips to apply that pressure as well. If you want to learn more labor comfort techniques and laboring positions so that you can move easier throughout your birth, check out our online childbirth education course. We have an entire section on labor comfort techniques, both for your partner to do and also things for you to do by yourself, plus tons of laboring positions that open each part of the pelvis because there's no one movement that opens your entire pelvis. You'll find that there's different types of movements that you're going to want to do. If you want more support throughout your pregnancy, you can also check out our online prenatal fitness programs. We offer it an app-based program and full-length workout videos so that you can move throughout your pregnancy to feel strong, while also helping to prepare your body for birth with pelvic opening and pelvic floor release exercises. You can check out our online childbirth education course and prenatal fitness programs on our website at MamasteFit.com and use code YouTube10 to get 10% off, and you can bundle them together to save an additional 15% off. Thanks so much for watching. I hope this video was helpful for you. I would highly recommend that you and your partner practice these techniques before your birth so that they're more familiar for you when the big day comes. If you enjoyed this video, be sure to like and subscribe to our channel so you get notified whenever we release new videos. And thanks again so much for watching.